Right, Nick.
Absolutely. So my name is Niki Panich. I'm a family physician data scientist, and I recently finished a year at Stanford Graduate School of Business. It is my absolute pleasure to introduce you to Calumeo, a point of care solution for N95 mask disinfection. I met what is now the multidisciplinary Calumeo team as part of my Stanford GSB courses in early 2020. This team entered and were selected amongst the winners of a Johns Hopkins COVID Design Challenge in March of 2020, and so began the Calumeo journey. Just to give a bit of background, I'm sure all of us know more than we ever wanted to about N95s, but just to set the stage, they're single-use masks, or what used to be single-use masks, that form a complete seal to the user's face and have the ability to filter out airborne viruses, particularly those that are less than 0.3 or greater than 0.3 microns. Given the current pandemic, supply of new masks continues to be a problem, and thus has spurred a new industry in N95 disinfection. All inpatient hospitals and skilled nursing facilities in California are sponsored by the state government and have implemented mass scale decontamination through Battelle, which was the very first company to have EUA authorization through the FDA. There have been other mass disinfection approvals. And the way that it works is that the N95s are collected, shipped to a centralized processing center where they're treated in bulk with vaporous hydrogen peroxide gas, a chemical, and then returned back to each site for reuse. It's similar for other companies that do mass disinfection. And the off-site processing leaves a residual odor. Many of the physicians in the group will be aware of that, probably having used them, and of the nauseating effects. Battelle is well suited for large mass volumes. It is not suitable for small clinics like my own. Doctors, dentists, therapists' offices are open and seeing patients at full capacity. The medical workers and office staff are at risk for COVID exposure, but mass decontamination is not economically viable in the outpatient setting. The number of used masks generated by a clinic is not enough to justify the cost. So individual providers are turning to crowdsourcing group orders in order to compete for N95 shipments to secure orders at a group rate. We know that the hospitals in states with subsidies and large hospital systems where bulk decontamination makes sense may do that. However, what about smaller hospitals or clinics? What about outpatient facilities? Medical field use in the military? Medical face-to-face non-services such as barbershops and nail salons? These also represent a large gap in the market. Healthcare workers have identified many issues with the current solutions. Bulk disinfection means that you don't get your same mask back. Colleagues of mine have talked about receiving masks with other people's makeup on them. Many people feel nauseated from the vaporous hydrogen peroxide and wonder about the long-term effects of breathing that gas in for hours and hours upon end. Some healthcare workers and unions are outright refusing to use chemically processed masks. I want to take a moment to reflect on the tragic lives lost during COVID-19. Unfortunately, some of these lives are lost due to the lack of personal protective equipment. And that is why our solution for healthcare workers to decontaminate masks at the point of care is so meaningful. Our device has three essential elements. We must be able to inactivate the COVID virus. We must preserve N95 fit and function, and we must have countertop implementation for end users to use at the point of care. With these factors in mind, I'm very excited to introduce Calumeo, a solution for small-scale N95 disinfection that's used at the point of care. Our solution employs dry heat without any chemical reagents, so it's safe to be end-user operated. Conditions for dry heat inactivation of coronavirus are well established at this point. Dry heat is being used in large-scale decontamination services that have already been approved by the FDA, and in many do-it-yourself ways by healthcare workers. From our discussions with the FDA, we believe that we are one of the very first to submit a point-of-care device. Just after US Thanksgiving, the FDA issued an emergency use authorization endorsement policy approving dry heat bioburden reduction systems like Calumeo. We are excited to announce that our device meets all of the specifications. So how does it work? Our process is quite simple. A user takes their N95 mask, puts it in a Tyvek disinfection bag, places it in the device, runs an approximately 75-minute cycle, and at the beginning of their next shift or clinic, takes out their mask and is ready for reuse. Masks can be reused up to 5 times with this technology. There is some suggestion that it could be up to 20. I want to highlight our strategy for accelerated engineering. We have a unique partnership with a company called Phoenix Ventures, which is a full service development and medical device manufacturing firm in the Bay Area. Phoenix's support and well-resourced facilities have remained open as an essential service during the pandemic and have enabled us to move quickly to get a product to market. Our device has undergone and passed rigorous safety testing, and you can see some photos of some of the testing that we have done. Calumeo's value to healthcare workers is clear. It increases their access to clean N95s. But there are also significant benefits for the buyers. By protecting healthcare workers, continuous patient care is safeguarded, and we all know of canceled surgeries and the results as a result of the pandemic and the difficulty this has caused for patients. Some employers are facing backlash for inadequately providing N95s, so this would improve relations. It also decreases the amount of hazardous waste generated, and waste disposal is expensive. Finally, it provides assurance for future shortages. How does this happen? In the past, N95s were stockpiled, taking up large amounts of space and generating waste from many expired masks. With Calumeo, mask reuse would allow for fewer masks to be stored, used, and wasted. One of the consequences of the increased mask use has been increased mask waste. Our long-term vision for Calumeo is as a company that addresses the broader issue of PPE reuse and waste. COVID has transitioned us into a new era of increased PPE use and thus increased PPE waste. The science suggests that COVID, like influenza, could have an annual surge and require annual vaccinations just like the flu. In fact, the FDA recognized this in May of this year with new product codes for decontamination systems for what used to be single-use PPE. Calumeo follows under the QLA code. We envision future products that offer higher levels of disinfection and address other types of PPE. We also see opportunities in non-medical sectors, for example, in retail after clothes are tried on, or in the food sector with cooking aprons. While new N95s are typically cheap and highly scalable, they are not available, thus users are turning to mass decontamination technologies. This is a crowded space with Battelle as the industry leader. Calumeo has a much lower face value and is designed to be more user-friendly. Looking at processing cost per mask, you will see that Battelle is currently estimating a processing cost of $10 per mask, which is higher than the purchasing price of a new mask, but of course, supply is limited. Calumeo is designed to have a low cost to operate and comes in undercutting the competition. It has a large TAM and SAM, including healthcare and non-healthcare, such as barbershops and salons. We have a broad outreach strategy and would like to get Calumeo into healthcare facilities all across the US as soon as possible. We are looking for physicians and other healthcare workers who would like to see this product in their offices and on the wards. If you are interested in the device for yourself or your facility, please reach out. I'm happy to answer any questions that you may have.
Thanks, Niki. Okay, finished. You got an extra minute and 30 seconds added on to your question time. So questions, judges? Anyone have any questions?
Gary, there's some questions in the chat.
Okay, well, you could just say it out loud. I mean, it's easier that way.
Somebody put, how many masks can be disinfected at the same time? Will people get their own mask back, or will they be interchanged?
Yeah, so the whole purpose is for people to get their own mask back. You almost have to think of the journey of the mask. You know where your mask has been. You know if your mask should have been discarded, if there's blood on it, if there's, if it's soiled in some way. And you keep track of how many times your mask has been disinfected. The current device holds 6 masks, and the cycle time is about 75 minutes.
Okay, another question. How many masks have been decontaminated with this device so far?
Hundreds to thousands.
Okay. And Neil Gray is asking, can you sterilize other medical equipment or just masks in this?
So the EUA at this point just covers masks. There is suggestion that this technology could be used beyond that, and 510K application will be in order in future for that.
Another question is, how protected is this process? Is it, so what kind of IP coverage do you have?
Yeah, so we have filed a provisional patent as part of the work that we did at Stanford.
Okay, great. Let's see. How many does it take to justify this to a health system? In other words, so what does it cost to implement? And I guess the real question is, especially at an enterprise level, how many of these would you need, let's say, in a surgery center versus freestanding emergency room versus an enterprise level system?
Yeah. So at the cost of the device and the current average mask cost, it pays for itself in 160 cycles. So depending on so if you're running it once a day, that's 160 days. If you're running it, multiple times a day, it's much less than that. We've been asked about a larger scale version of the device that holds, 15, 20 masks for larger systems. And certainly that is possible and in relatively short order as well. But we were trying to fill the gap in the market for, small offices and dental offices that don't necessarily have the ability to do the mass disinfection.
Okay, so I guess from a venture capitalist, I put my VC hat on. And you're making an investment in the company. So are there discussions about making enterprise level solutions for utilizing this technology, because there's clearly a need for it?
Yes, absolutely. And as I said, that's been one of the questions that we've been asked. And so we've done some work into what the size of a base device would need to be able to accommodate 15, 20, even 25 different masks. And we do have options to be able to pursue that in relatively short order if the demand was there.
Another good question is, so, clearly this was somewhat reactionary to a pandemic environment, which we know we're going to be in for a while yet. But where do you see the business going once the pandemic?
Am I cold?
Sorry. Cute. So where do you see the business going post-pandemic?
Yeah, so the waste reduction, medical waste reduction, we see as a big unmet need. And the picture of the gentleman holding the fishing line in the ocean, I think just speaks a thousand words of where are all these masks. And that's just masks. We haven't talked about gowns and all sorts of other things that we know we use without even thinking twice about and discarding them. Okay. I think the world is just more aware of the waste generated by medicine.
And what does it cost to make, and what's the expected price commercially?
The expected price is $4,000, and I would be happy to discuss the costs of production offline.
And is that being made domestically or outside of the country?
The base is made outside of the US, and then there's certain modifications that need to be made to meet the US certification standards, the UL certification standards. So there is a touch point in the US where we ensure that all of the devices meet safety standards for the United States.
Okay. What about exposure in terms of the process? Is there any potential exposure to the environment?
In what sense?
Well, I guess, you have a process, I guess when you walk through it, so you're using like a hydrogen peroxide gas, right? Is that what I think?
No, there's no chemical at all.
So there's no chemical. So there's no exposure at all from the process. I'm just reading a question. So
no, that's one of the things that that really excited me about the technology is the fact that it is chemical free.
Okay, great. Thank you. That answered several questions.
And it's not UV based. I know a lot of people wonder about UV. UV has a significant risk in damaging N95 filtration. And if you damage the filtration, then the mask obviously doesn't work in the way that you expect it to.
Okay. And I'm sure in your testing, so a question here from one of the attendees is, what's the end user adoption? In other words, the mask goes through the process a few times, a couple of times. Are the end users, are there any complaints about those masks that are being reused?
No, the feedback has been exceptional.
Okay, great. Anybody else chime in? Feel free from the judges. Let's see.
Gary, I have a question.
Okay, great.
Yeah, so, I've seen many devices that are actually similar that, you just turn the heat up and you try to dry and clean things. I didn't see anything that was really out of the box here. So you basically just put the mask into this device, you heat it up, and then it destroys the virus. But I mean, I see similar devices already out there. What is really the difference?
The thing that makes our mask device unique is the precision of the temperature. There's a very small range of temperature that's safe in order to kill the virus and not destroy any of the filtration properties of the mask. So the temperature uniformity of the chamber is what makes it very unique.
Okay, great. Thank you. Okay, so our time is up. Thank you for a great presentation, Niki. And let's let the audience vote.